Hello and welcome to Medical Dialogues. I'm Anjika Mishra. Today we'll talk about daily steps of 9,000 to 10,000 may reduce death and cardiovascular risk in sedentary people. According to a study published online in the British Journal of Sports Medicine, every additional step up to around 10,000 steps per day reduces the risk of death and cardiovascular disease regardless of how much remaining time is spent sedentary. Previous studies have suggested that higher daily steps count correlate with reduced death and cardiovascular disease rates, while prolonged sedentary behaviour is linked to increased CVD and death risk. Led by the University of Sydney Charles Perkins Centre, the study examined data from 72,174 individuals in the UK Biobank study. Participants wore wrist accelerometers for 7 days to measure physical activity. The median daily step count for participants was 6,222 steps per day, and 2,200 steps per day was taken as the reference point for assessing the impact on death and CVD events of increasing step count. Individuals sedentary for 10.5 hours per day or more were categorized as having higher sedentary time, while those with less than 10.5 hours per day sedentary were considered low sedentary time. Accounting for other factors, the optimal step count to counteract high sedentary time was 9,000 to 10,000 steps per day. Notably, half of the benefits were observed at 4,000 to 4,500 steps per day in both cases.
Are you also aspiring to excel in medical journalism and delve into the intricacies of health and medical reporting? Explore our comprehensive course on medical and health journalism available at the Medical Dialogues Academy. Learn from industry experts who possesses in-depth knowledge and experience in this field. For further details, scan the QR code provided or access the link in the description box below.
The findings reveal that taking 9,000 to 10,000 steps per day could counteract high sedentary time. This reduced mortality risk by 39% and incident CVD risk by 21% over an average follow-up of 6.9 years. Any amount of daily steps above the referent 2,200 steps per day was associated with lower mortality and incident CVD risk for low and high sedentary time. Occurring between 9,000 and 10,000 steps per day optimally lower the risk of mortality and incident CVD among highly sedentary participants. The minimal threshold associated with substantially lower mortality and CVD risk were between 4,000 and 4,500 steps per day, said the authors. Our prospective results provide relevant findings that can be used to augment public health messaging and inform the fourth generation of device-based physical activity and sedentary behavior guidelines, which will likely include specific recommendations on daily steppings. Thank you for watching. Stay tuned to Medical Dialogues for more updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.